When it comes to proportions of your body, there might be some parts you just don't like and you want to change, and that's totally okay. So we're going to talk about them today with Dr. Ward, and he brought a friend. Dr. Kordestani is here. We're finally meeting him. We've heard about you, but welcome to Utah.
Well, thank you. Thank you for having me.
Of course.
It's been an interesting welcome.
Interesting. It's been a lot of snow, hasn't it?
Yes.
Yes. A lot of things. So Dr. Ward, you're the facial plastic surgeon, and Dr. K, you're the body plastic surgeon. Let's talk proportions.
Let's talk proportions. Before we do, though, I have to say we are so happy to have Dr. Kordestani be part of the team. He's a plastic surgeon with tons of experience in Texas for years, and we are so happy to be able to convince him to come and join us.
And what convinced you, Dr. K?
Well, it's actually a very good question. The main thing was we're going through a lot of different transitions in North Texas, and this opportunity came up, and it seemed like a good fit. So we've been going back and forth, but I think it's going to be a very neat relationship.
And how about Utah in general? You know, the outdoors, do you like it? I hope so.
I like the outdoors. I'm not much of a skier, which is, you know, a transgression, so I'm sure. But the thing that really impresses me coming from Texas is just people in Utah are just so nice.
Good.
It kind of throws you off.
We hear that a lot. Yeah. So, and I really do become friends with my interviewees, and it's so much fun. So don't worry, I didn't love skiing that much either, and I'm now a skier to make it through the winter. So we'll get you there, Dr. K. Okay. So we're going to talk body proportions, and we're going to talk face proportions. So let's do the overview. What's too much? What's too little?
Well, I think that too often we have this stigma with plastic surgery that we need to change things, or major changes, or like bigger is better, or something like that. I think that's totally wrong. I don't think it's an overhaul that we're looking for. Yeah. I think it's just kind of a refresh. And proportions, if we think about proportions, that's really the reason that we choose to have these things with our appearance. You know, whether I've got too much volume here under my chin, I don't like that. Or I've got like saggy jowls, I kind of want it back where it used to be. Or maybe the tip of my nose is too big. Or, you know, in his realm as a plastic surgeon, you know, with the body, like with the hips, with the breast, with the chest, like how do we get those proper proportions to make you feel kind of more secure, more confident?
Well, and I actually know people who felt like, you know, their breasts might have been too small for their body type and vice versa. And they have done that, and they have felt so much more confident, but it wasn't about enhancing too much or beyond what was normal for their body. It was about enhancing to make them confident,
right? Which
I think is what you guys probably try to, and obviously if somebody wants big, you know, go big or go home, you'll do it. But you probably try to walk them through what's best for their body, correct?
Well, you know, coming from Texas, that idea of, you know, again, Texas being big, and so we're used to that. But the main thing is, you know, I've done time in Texas, done time in Miami. Everybody is different.
Totally.
So the main thing is, and one of the things that's classically leads to poor relationships is when the doctor, the team, and the patient aren't on the same page. So that's one of the things that's actually really neat about our team is there's a lot of conversation before there's an actual surgery, because we really want to make sure that everybody's on the same page, because you may want to say something, you may want something, and it doesn't translate, that loss in translation. And that can be disastrous.
Absolutely.
So the main thing is to make sure that everybody on the team, including the patient, really gets an idea what they want, and we go back and forth. Once everybody makes sense of it, that's when you do the surgery. So after years of surgery turns out to be actually the easiest part of it.
Probably. It's the conversation that's tough. Well, and I think it's probably wise to walk people through, you know, whether they want to change their nose or a part of their body, just walking them through doing a slower process. It's always, you know, easier to maybe add more, right, than do small changes as opposed to one big change overnight. So if people want to come in, have the conversation with you too, where can they contact you?
So go to the website, wardinstitute.com, or call us at 801-513-3223.
Fantastic. And we're going to make it super easy. We're putting a QR code on the screen right now. Grab your phone and open up the camera, and it will take a picture of it, take you directly to where you need to go to chat with the doctors. Thanks so much for being in, you guys.
Thank you.